Hello friends, welcome to the Gesundheit Kitchen. My name is Hans Rufert and I'm joined by my dear friend, Dr. Ellen Steinberg.
How are you?
Doing great, thanks for joining me.
Excellent.
Beautiful outside today, so we're taking advantage of the scenery. Wanted to talk about, with a name like Hans, like people always assume, right? Are you German? Do you eat sauerkraut? And how much beer
There
can
you
you put
go.
down? So I have to say, in full disclosure, that in my prime, I could put a beer or two down. I mean, that was didn't quite brush my teeth with beer, but I was raised in a house of beer. But I have no stomach anymore, and obviously stomach cancer has rearranged some things. But that's a question I get asked a lot. What about alcohol, right? So what for someone with a partial stomach, no stomach, and we'll talk about alcohol from the health side too, but I mean just the effects of alcohol,
Sure.
right? So that's kind of what I want to talk about, especially right now. I don't know what time you're watching this, but right now we're approaching the holidays as you and I sit here. So whether it's the holidays or whether it's a time of anybody's celebration, oftentimes that just enters the picture.
Sure.
And so how you mitigate that, how you handle that. So that's I didn't bring any with us. Sorry, there's
that's okay.
no sampling, but let's talk about alcohol in general as a thing.
Well, first, let's start by, yes, you can drink in moderation as anyone, but I do recommend, especially in that first 6 months, year,
Sure.
certainly don't put it in the equation that soon.
Got it.
And if you do want to incorporate alcohol into your overall diet, talk to your physician first. Assuming all is well and there's no reason you shouldn't drink, then yes, enjoy an occasional alcoholic beverage. I will say that without a stomach, you can expect it though to affect you a lot sooner, a lot quicker, and probably hang around a little bit longer than you were used to, when you had your stomach.
Oh, listen, just anecdotally, I mean, I was probably prior to surgery, I weighed about 100 pounds more, and that 100 pounds went a long way to absorbing, some of that. And also the twists and turns and the stomach sort of sitting there and holding that with the stomach acid, trying to negate some of that. Now a half a beer, I'm feeling it, right?
Exactly, and even think about when you had your stomach and you drank on an empty stomach. Think about the difference you felt when you had just eaten a meal, maybe had a beer, versus not had a meal, drank a beer. Of course, when you have your stomach and there's food in there and fat, that slows the absorption rate. If you have a partial stomach or no stomach, think about it now. It is going really straight into your not straight into your bloodstream,
Sure.
but it goes and it is absorbed very rapidly.
No, that's a great. I hadn't thought about that. Drinking on an empty stomach. I didn't think about that analogy there, but you're right. I mean,
Right.
if and there are some people who maybe in their college days their intent was to get as drunk as possible, right? And so that was one of the strategies. Well, I'm not eating it. It's going to hit hard. And as you said, the duration of those effects, if there's nothing there to buffer that or act like a sponge and sort of absorb some of that, where's it going? It's going.
There's this, your body produces what's called alcohol dehydrogenase, okay? Alcohol dehydrogenase. The majority of it is in the liver. So we know that the majority of alcohol metabolism is in your liver. But there is a little bit in your stomach. I think it's called like alcohol dehydrogenase 4 or something. It doesn't matter, but the point is that your stomach does have some. So it's sort of like a first pass.
Got it.
That it gives it an opportunity not to metabolize all the alcohol, of course not, but it sort of starts the process.
Got it.
And without that, yes, it goes into your intestines and it absorbs into your blood very quickly.
Well, which we see the same with, and you and I have talked about blood sugar, same sort of a thing, right? So, I mean, anything that we are consuming seems to get, if it is absorbable, because some things have to go through the first stage of
Sure.
going through the sort of maceration that happens in the stomach. But if it can be absorbed, since we're sort of bypassing that first pre-filter, it's getting straight to to the absorption
Definitely.
area. And again, we feel it a lot faster, which, for a lot of people, drinking any liquid and eating at the same time is a bit of a challenge because liquid takes up physical space, especially when you have
Right.
partial gastrectomy. It basically is a much redacted pouch,
Sure.
and so liquid fills up a lot of that space. So, drinking and eating can be a tough thing anyway. So what I've found, the whole concept of mindful eating, and I talk about that a lot, especially when I'm dealing with people around holidays or family gatherings, we're in this mindset of we're already trying to get the next bite ready as we're chewing. Or we already are picking up the glass,
Right.
it's almost like this race to shovel everything in. So switching modes and having that mindful thing where you're not going by how many glasses. If I'm at a party and somebody's free pouring, I'll put my hand over the glass.
Right.
That give me 2 fingers so that of that much liquid in the glass is enough for me to enjoy the taste, to be able to raise a glass and have a toast when everyone else toasts it. I don't feel like I'm alienated, but I'm also not trying to finish the bottle.
Exactly. And there are, as we know, there's so many different types of alcohol, whether it be spirits, gin, vodka, all of that, or whether it just be white wine or a beer.
Yep.
It will be very important to check what the proof of the alcohol
Yep.
is, what the percentage of alcohol is. And certainly when you're experimenting with drinking alcohol again, look at that percentage and go low. Maybe a light beer that would have maybe 2.5 to 3% alcohol, whereas something like a gin would have 40 to 50% alcohol.
Right.
So it's real important to understand the alcohol content of what you're drinking.
Well, and the other thing too is just like if you can remember back to when you had a full stomach, oftentimes we wouldn't get the signal that we were full until we were sort of beyond the point of being full.
Sure.
And I would say the same thing with alcohol. At the point where you're starting to feel like there's a little bit going on there, it can still go higher.
Right.
Right. So some people feel like, oh, I'm just getting that buzz, and if that's what they're looking for, but without a stomach, that buzz can turn into full inebriation in a very short period of time. You don't have that ramp up necessarily.
Right. And especially if you're looking for like a mixed cocktail, you're also typically they're mixed with sugar.
Yeah, that's a great
or
point.
Carbonation.
Those mixers, you're right.
So be careful of the mixers. Again, I just highly recommend starting very slow. I mean, as you said, you drink a half a beer now and you feel it. So, pay attention to your body.
Well, and the thing that I kind of want to wrap on here is that there are so many great alternatives now. Now, there've always been alternatives to
Sure.
You don't have to drink alcohol, right? But there are these mocktails, which
Yep.
are very much akin to the same sort of flavor profiles. There are alcohol-free beers, which are, a long time ago, that was sort of an oxymoron. Why would you have them? But
Exactly.
there are some fantastic alcohol-free beers that are, if you're drinking beer for the flavor, they're wonderful. There are some great alcohol-free wines now, which have gone through that fermentation process, so they have all of the tannins and that sort of complexity that you're looking for in a wine, just without the alcohol. And there are now these spiritless or spirit-free gins that have
Right.
they have the herbal, they have the juniper, so all of the nuance and flavor that, from a culinary perspective, all the things you're looking for are there, but you just don't have the alcohol.
Right, and if you did used to enjoy like a wine pairing, now, as you said, there are alcohol-free alternatives that you could experiment with and try to pair it with different foods.
Right.
See what you like.
I think that's you mentioned right off the top that moderation. And I
Definitely.
think, having gone through a life, fairly drastic life change, it forces us to look at things quality over quantity. Right?
Always.
Always. And so it's okay to have a tiny, little bit in the greater picture. And if you're focusing on that quality over quantity, your sort of justifications behind drinking. Again, for me, it's more of a social thing. I want to feel included. I don't want to be the one guy that's having a glass of ice water which is shallow on one side, but it's also celebratory. It's cultural, and having these alcohol-free options, or even just lowering the quantity,
Right.
allows you to be a part of the party without being the
Right.
guy, beyond that guy that's standing out. So.
But it does make you feel, it does allow you to embrace the same sort of feeling as whatever the occasion may be.
Yeah.
And, not that you or I would ever promote, if you never drank alcohol, certainly don't start now.
Sure.
But if you enjoyed it before, there really is no reason, after you speak to your doctor about whether it's okay for you to have it, there's nothing wrong with experimenting with it and enjoying it.
Yeah.
And maybe you would find something that you like that has a very low alcohol content, so that it doesn't affect you so quickly.
Well, and a good friend of mine who happens to be a chef, for no reason other than we all know that alcohol as a thing is not necessarily a health food.
No, it isn't.
And so one of my chef friends has just started making a lower percentage cocktail. So her gin and tonic is no longer gin and tonic. It's more like tonic with some gin. You know what I
Right.
mean?
Yes.
So just changing the proportions still allows you to have that experience. You still get to be a part of, of all the things we talked about, but just cutting it down a little bit.
And like so much, I told you earlier, I was reading an article and all of a sudden it came up about the lower alcohol cocktails.
Yeah.
And so there's recipes, as we know, you'd have to keep your eye on the sugar content and
Yep.
things like that. But it wouldn't be hard, is what I'm saying, to find a recipe you may like.
No, I love it. Well, strangely, I feel like it's lunchtime and I could use a half a beer. If you'll have the other half.
Would it be corny just to say cheers?
I think cheers is a great Prost, as we say in German. But listen, again, it's a fair question, and
It is.
I think it's a great thing to, as you mentioned, always, anytime you're having if you can work one-on-one with a dietitian, with a nutritionist that knows your specific needs, that's always the best way. So we're here to kind of give some advice within a certain parameters. But at the end of the day, your body is unique to you, and so talk with your nutritionist and see what works. But don't be afraid to. You don't have to 100% exclude
No,
it from
not
your
at
diet.
all.
So. Well, thank you so much.
Yeah, it's always fun.
Take care, y'all. We'll see you on the next Tuesday Night Kitchen.